Hello everyone, my name is Maria Rivera and I am presenting Pharmacy Risk Assessment and Electronic Prescriptions. The authors of this paper are Michelle Baumann and Subrata Acharya. The content of this presentation is first introduction, where we're going to talk about purpose and goals, then benefits and challenge with e-prescriptions, then statistics, and finally controlled substance. The second part is investigation. We're going to talk about the risk assessment with an ISC framework. We are going to see two study cases. The first, retail setting with CVS Pharmacy, and second, an inpatient setting with Ascension Southern Hospital. Third, we're going to talk about the results and finally the conclusions of this study. The purpose and goals of this project was to identify risks and vulnerabilities in the e-prescribing landscape, identify the most relevant attacks in the eRx domain, and finally propose control recommendations for this risk. The methodology used for the development of this project was literature review and evaluation of different study cases with NIST risk assessment framework. First, as a background of this topic, it is important to mention the benefits and challenge of e-prescriptions. Some of the benefits include the improvement of patient safety thanks to medical error reduction. It also improved the prescribing process, integrating a drug decision support system and insurance information, where the prescribers can view which medications are covered under the patient's insurance plan, which saves money for the patient. Also, the electronic prescription system significantly improved workflow efficiency at pharmacies because all methods of receiving prescriptions through paper, fax, or phone require technicians to transcribe or input the information into the pharmacy's own system. On the other hand, some of the main challenges faced include some technical challenges like software not meeting the business needs or human errors. For example, prescribers can still make simple mistakes, such as selecting the wrong information in a pickup list or a drop-down menu. And finally, the initial cost for implementation and training and the system integration is also a challenge for the implementation of e-prescription systems. Some companies like Scripps, that was formed to align competing organizations towards the common goal of building a national network, also provide medication history to the prescription system. They claim to manage 77% of prescriptions in the United States. SureScripts Network Alliance transactions have more than with 6 billion transactions processed in 2010 compared to 13.7 billion transactions in 2017. Interestingly, only 69% of prescribers use e-prescribing software versus 98% of pharmacies during the year 2017. Thus, despite this rapid progress, there is still much work to be done in this domain, and it's important to note that no federal mandate currently exists for electronic prescription adoption. In 2010, the Drug Enforcement Administration, DEA, passed the Electronic Prescription for Controlled Substance Rule, or EPCS, which provides practitioners with the option to write prescriptions for controlled substance electronically. Nationwide, only 18.8% of controlled substances were prescribed electronically. However, increase of 59% of prescribers were enabled for EPCS in 2017. This study conducted the evaluation of the most critical risks in the pharmacy domain, using a number of data sources, including the U.S. Department of Health HHS and the Office of Civil Rights Breach Portal. The information uncovering the analysis of breach statistics was used to perform a risk assessment using the NIST model. The first risk assessment detailed a compliance failure by CVS Pharmacy. This case study provides an opportunity to demonstrate the importance of internal controls, plus the link between IT risk and regulatory compliance. Between 2007 and 2008, CVS Pharmacy unlawfully sold pseudoephedrine to organized crime due to his failure to limit the quantity sold to individual customers. Pseudoephedrine can treat sinus congestion and is a key ingredient in the manufacture of methamphetamine. In 2010, CVS was fined with $77.5 million as penalty for his failure to comply with regulations limiting the sale of pseudoephedrine. The U.S. Attorney's Office for the Central District of California asserted that these illegal sales were directly correlated with an increase in the methamphetamine production in California. To carry out the analysis of this study, the National Institute of Standards and Technology Framework, or NIST, was used. Was obtained from the special publications 800/30, that is a rich management guide for information technology systems. So the first step of the framework is system characterization. We determine from the analysis that the inputs for software is medcheck and lookback feature. For data and information is paper logbook. We also have people that they are the employees of the retail store and the distribution center. And the system mission is prevent illegally drug sales. From this was established that the outputs are the system boundary, which is many states nationwide. The system data criticality, that is maintain legal compliance by tracking drug sales. And about the data sensitivity and security, it have to be compliant with HIPAA. The second step of the framework is threat identification. To identify the threats, we use as an input history of system attacks and data from intelligence agencies. We could determine that the threat source is currently or previous employees. Their motivation could be revenge or negligence. And the threat action is knowingly, falsely, or destroy records, logbooks, or unintentionally total incorrect sum or sales. Another threat source identified was organized crime. Their motivation is financial gains, and the threat action is purchase controlled substance for manufacture of illegal drugs. The third step of the framework is vulnerability identification. For this purpose, we use reports from prior risk assessment, any audit comments, security requirements, and security test results. We identify two vulnerabilities from this analysis. The first one is that logbooks fail to track drug sales and legal limit is exceed. The threat source of this vulnerability is current or previous employees. The second vulnerability identified was software fails to track drug sales and alert employees when legal limit is exceed. The threat source is organized crime. The fourth step in the framework is control analysis. The inputs identified were current controls and planned controls. The current physical controls is behind the counter placement for technical controls check software. The fifth step of the framework is likelihood determination. 4 inputs were used for this analysis. First, the threat source motivation, second, the threat capacity, third, the nature of the vulnerability, and fourth, the current controls. For the vulnerability number 1 was determined that the likelihood is medium. Without the controls in place for employees to double-check or hold others accountable, there is potential for mistakes or malintent. For the vulnerability number 2, the likelihood is high because it's very simple for organized crime to prove the system by attempting illegal sales without any consequences. The sixth step in the framework is impact analysis. 4 inputs were used: mission impact analysis, asset criticality assessment, data criticality, and data sensitivity. It was determined that the impact for vulnerability number 1 is high because errors in or the loss of physical logbook could result in a loss of data integrity and illegal drug sales. For the vulnerability number 2, the impact is also high because tracking issues in the software system could result in a loss of system integrity and illegal drug sales. Illegal drug sales could lead to no compliance with the CMEA and DEA legislation, and any result fees, negative media coverage, and loss of reputation. For the seventh step of the framework, that is risk determination, the inputs used are likelihood of threat exploitation, the magnitude of the impact, and the adequacy of planned or current controls. It was established that for vulnerability number 1, the risk is medium, because there is a need for corrective actions to be incorporated within a reasonable time period. For the vulnerability number 2, the risk is high, because the strong need of corrective measures to be put in place as soon as possible. For the step A of the framework, the control recommendations made are: first, enable look-back software features for all states. Second, monitor sales at both the store and distribution center level. Third, annually train employees on federal and state legislation's requirements, plus which substances are used in manufacture of illegal drugs. Fourth, develop an anonymous reporting system for employees, plus require management to investigate all reports. And finally, integrate the routine log check by multiple personnel on a weekly basis. And finally, for the step 9, that is results documentations, a final report was made. One of the main results from this study was that cases like CVAs illustrate how mistakes with software configuration can pose an IT risk, exposing companies to legal incompliance. As a conclusion of the study, was determined that the top 3 challenges in the pharmacy domain include a lack of the implementation of essential software functionalities, the loss and theft of portable devices, and email phishing attacks. From the software perspective, providers and legislators should work more closely with software vendors' specifications, gradually update legislation and incentives to require specific functionality. From the data breach perspective, a number of physical and technical controls should be implemented in pharmacy and hospital settings to reduce the frequency of loss and theft of portable devices. Additionally, it is important to create a culture of awareness by both training employees on recognizing phishing attacks, but also discussing current breach incidents. Finally, healthcare providers should always follow HIPAA minimum necessary guidelines and limit data access for each user to only what is truly required to perform the duties of his or her role. Thank you so much for your attention.